If you suffer from heartburn, you're not alone. Across the United States, 60 million Americans experience heartburn at least once a month. And when they do, they turn to over-the-counter drugs to relieve the discomfort and pain. However, for some people, heartburn is much more than just a nuisance.
Every time you sit down and have a meal, you knew you were going to suffer afterwards. I would have to wake up in the middle of the night and take antacid.
I found when I laid down to sleep, I coughed more in the evening, so it was difficult to sleep. I noticed that I was having problems with nausea.
I can buy a pack of Rolaids, now and then. Well, I got so the Rolaids were in my pocket every day, and every jacket I owned, my nightstand, there was a pack of Rolaids, my vehicle.
If you're suffering like these people, if you're experiencing heartburn 2 or more times a week, you might have more than just simple heartburn. Heartburn by name doesn't sound serious. It seems more of an annoyance than something that could cause long-term health problems. But is it that simple? Dr. Joel Richter is a gastroenterologist at the Cleveland Clinic Foundation. He and other experts from the American College of Gastroenterology have created a public education program to help people determine if what they're suffering from is just common heartburn or if it's something more serious.
We want the public, the American public, to realize that a little heartburn is just a nuisance. But if you're having heartburn several times a week, or if it's associated with swallowing problems or weight loss or blood loss, if it's associated with asthma or chest pain or hoarseness, you may well have a disease and you need to see a physician.
Take this simple acid test found on the back of the brochure included with this tape to see if you may have a more serious problem and learn about the range of steps to treat it. Keep track of how many times you answer yes. Do you frequently have an uncomfortable feeling behind your breastbone that seems to be moving upward from your stomach? A burning sensation in the back of your throat? Or a bitter acid taste in your mouth? Do you feel these problems after meals? Do you experience heartburn or acid indigestion 2 or more times per week? Do you find that antacids only provide temporary relief from your symptoms? Are you taking prescription medication to treat heartburn but still having symptoms? If you said yes to 2 or more of these questions, you may have more than common heartburn. You may have acid reflux disease, or GERD, which stands for gastroesophageal reflux disease. To better understand acid reflux disease, it helps to first understand what causes the discomfort most people think of as heartburn. This is the esophagus, the passageway that takes what you eat and drink down to your stomach. The acids in your stomach help digest your food. In between your esophagus and your stomach is a muscular valve called the lower esophageal sphincter, or LES. When it is working properly, the LES keeps stomach acids from moving up into the esophagus. Acid reflux occurs when the LES relaxes too often, and it allows stomach acids to reflux or flow backwards into the esophagus for long periods of time. When this happens frequently, doctors become concerned that it's more than simple heartburn. Frequent reflux exposes the esophagus to powerful stomach acids, which can eat away at its lining and cause significant damage. Understanding what causes acid reflux disease may leave you with even more questions. We compiled a list of the most commonly asked questions about acid reflux, or GERD, and went to several gastroenterologists for answers.
If you have mild forms of reflux, you can be treated with antacids or other over-the-counter medicines, but if this becomes more frequent, occurring 2, 3, maybe even perhaps more times a week, then you don't really just have heartburn, then you have GERD, and you may need to seek further care.
Gastroesophageal reflux disease can cause a narrowing of the esophagus, which we call a stricture. It can cause bleeding of the esophagus. Or even more importantly, it can result in a precancerous lesion in which the normal tissue of the esophagus is replaced with a precancerous type tissue that we name Barrett's esophagus.
Only about 25% of patients who have fairly severe chest pain are actually going to be having a heart attack. But the anxiety because of the location of the pain becomes very real. The physician needs to evaluate those patients and find out what is causing it so they really can resume their normal activities.
It's interesting how heartburn can masquerade as other problems. Did you know that asthma can be caused by heartburn? That severe coughing paroxysms and hoarseness and sore throat, and even chest pain mimicking a heart attack, can all be caused by heartburn. And what makes it difficult is frequently the patients don't have the classic symptoms of burning in their chest or acid coming up into your mouth.
Your doctor may perform one or more diagnostic tests to see if your esophagus is healthy or whether acid reflux has damaged or changed the tissue lining your esophagus. Barium esophagram, or upper GI X-ray. This is a test where X-rays are taken to outline the anatomy of the digestive tract.
Taking a good look here.
Endoscopy. This is a simple outpatient procedure which allows the doctor to visualize the esophagus for any problems. Esophageal manometry, or esophageal pH. This test measures pressures and function of the esophagus. The doctor also measures the amount of acid that is refluxed into your esophagus. Your doctor can determine which, if any, of these tests are appropriate for your situation.
The good news is if the diagnosis is made, we have the medicines or the surgical procedures today, and it's going to get better in the future, to basically control this disease and potentially cure it.
Lifestyle modifications are very important in treating acid reflux disease.
Lifestyle changes, like not eating 2 hours before I went to bed, elevating the head of the bed, watching the foods I ate, avoiding coffee, caffeine, chocolate.
This is one of those positive things. You don't have to suffer at home. You don't have to put up with it. I think a lot of the American public from these television ads and everything think heartburn is part of living in the good old United States. It isn't. You can eat those things that you want to. You can enjoy yourself.
I've noticed an improvement in my symptoms. I cough less at night when I'm sleeping.
I could sit down and I could eat chili, spaghetti, or anything, and I will not get an indigestion or an acidy stomach over it.
Go see your physician. Let he or she evaluate the severity of the disease and go from there.
See your doctor. If you or your primary care physician decide you need to see a gastrointestinal specialist, consult the list of American College of Gastroenterology members in your state that accompany this video. Ask the doctor to talk to you about acid reflux disease and GERD, and follow his or her advice. Take the medication prescribed to you. And pass this video on to someone else who feels like they may have acid reflux disease. A little heartburn is a nuisance, but if you have symptoms more than twice a week, it could be something serious. Acid reflux disease. Heartburn is a common but not trivial condition. If you suffer infrequent heartburn, antacids or the new over-the-counter acid blockers may provide relief. If you have heartburn more than twice a week, you may have acid reflux disease, which can be serious. If you take something for heartburn more than 2 times a week or still have symptoms on your over-the-counter or prescription medicine, see your doctor or gastroenterologist. Acid reflux disease has a physical cause that's not your fault and can only be treated by a physician. With effective treatment, including prescription medicines, you can become symptom-free, avoid complications, and restore the quality of life you deserve.